Welcome, and thank you for joining us today for Protecting Americans from Extreme Heat. I'm Jill Rosenthal. I'm the Public Health Policy Director at the Center for American Progress, and I'll be moderating today's conversation. First, for a quick overview of our event, I'm going to share some brief context for the topic of today's event, and then I will turn it over to Representative Jennifer McLendon to share some remarks, followed by a fantastic panel of experts and some time for audience questions. Please use the Q&A feature at the bottom of your Zoom screen to pose questions as we go. And if you'd like captioning, please click the captioning button at the bottom of your screen. A recording of the event will be available on our website after the event concludes, and links to relevant CAP products will be shared in the chat throughout the event. So first, to set the context, this summer was the Earth's hottest summer on record for the second year in a row, and 2024 is on track to be the hottest year recorded. Climate change is the main driver of extreme heat, which is becoming more dangerous every year. In addition to causing disease, injury, and death, extreme heat adds $1 billion each summer in healthcare costs, just from hospital admissions and emergency department visits alone. It lowers economic productivity, and it disproportionately affects particularly vulnerable populations due to high heat exposure, pre-existing health conditions, and other underlying social and economic inequities. The issue is daunting and makes action even more urgent. This summer, the Center for American Progress released a series of products, including reports, fact sheets, and videos that elevate policy proposals to protect those who are particularly vulnerable to extreme heat and to make progress in reducing pollution that increases extreme heat and accelerates climate change. So we're going to talk about some of those proposals in our discussion today. To start off our conversation, I'd like to introduce Representative Jennifer McLendon, who is a champion on this issue. Representative McLendon entered the U.S. Congress in 2023 after serving the Greater Richmond area in elected office in the Virginia House of Delegates and the Virginia State Senate for nearly 20 years. In her years in the Virginia General Assembly, Representative McLendon championed landmark bills to protect and expand voter rights, combat climate change, preserve reproductive health care, enhance workers' protections, and labor rights. In July of this year, Representative McLendon led efforts to introduce a resolution recognizing the threat of extreme weather to children's health and well-being and calling for rapidly and equitably deploying solutions to address the unique vulnerabilities and needs of children.
Good afternoon, and thank you to the Center for American Progress for hosting today's important discussion on the need to protect Americans from extreme heat, and for your ongoing leadership to protect the planet and promote peace and shared global prosperity. Your invaluable work strengthens our collective efforts to build a future that supports every American and cultivate a healthy environment where all can thrive and succeed. The climate crisis worsens with every given day, and the impacts become more apparent as extreme weather events increase in severity and frequency. In my home state of Virginia, we've experienced devastating wildfires, sea level rise, flash floods, and record-breaking heat waves, and these problems are felt across the nation. Heat waves kill more people than any other type of severe weather or climate disaster and can lead to a wide array of heat-related injuries. Extreme heat also jeopardizes entire ecosystems and threatens the biodiversity of our planet, as plants and animals are forced to contend with changing environments and irregular weather patterns. The climate crisis threatens the health and lives of every child, every American, and everyone on our planet. And that threat will continue to grow without immediate, decisive action. I am part of a very small club in Congress, one of the 6.8% of members who are mothers to young children, and one of the less than 3% of members who are mothers of color to young children. And as a mom to a 14 and 9-year-old, I work every day to take action against the climate crisis to ensure a healthy, livable planet for them and their children. For too long, vulnerable populations have borne the brunt of our worsening climate and environmental degradation, including low income communities, communities of color, and other vulnerable populations. Too often, though, the adverse impacts of the climate crisis on our children are not addressed. Babies, children, and adolescents are particularly susceptible to the adverse health impacts caused by extreme weather, including heat stroke, exhaustion, respiratory and cardiovascular issues, and more. The impacts of extreme heat become apparent even when our children are on the playground, where they run the risk of serious burns from playground equipment. Children today also face record rates of climate anxiety, the fear that their future will be worse than their parents due to the climate crisis. And those concerns are not unwarranted. But we are fighting to address the climate crisis and ease its physical and psychological impacts on our youth. Thanks to the leadership of the Biden-Harris administration and the hard work of congressional Democrats, we have taken historic actions over the past 3.5 years to address the climate crisis and supercharge our transition to a clean energy future. The Inflation Reduction Act, passed in 2022, represents the largest federal investment in climate change mitigation and clean energy technologies in our nation's history. And as we implement the historic provisions from that bill, Americans across the nation are experiencing the benefits. Everything from electric vehicle tax credits to electrifying our federal fleets, home energy efficiency upgrades, robust investments in other clean energy technologies, and widespread efforts to advance environmental justice and protect historically underrepresented and overburdened communities. We can't stop now. We must continue working to implement provisions of the IRA and take additional steps to combat rising temperatures and preserve our planet for future generations. As parents, we have a responsibility to ensure a healthy, livable environment for our children and grandchildren because there is no planet B. I will continue fighting in Congress to advance forward-looking policies that reduce greenhouse gas emissions, ease our reliance on fossil fuels, and invest in greener, more sustainable energy sources. And I look forward to continued collaboration with environmental champions, advocacy organizations, and other leaders like the Center for American Progress. I thank you for creating space for this important conversation and your ongoing efforts to combat extreme heat. Please know that my door is always open and you have a partner in Congress. Thank you.
Representative McLendon has raised some important policies and programs that we will delve into further today with a conversation with our panel. So I would welcome our panel members to come on camera, and I'm excited to introduce them. Mayor LeVar Stony is serving his second term as mayor of Richmond, Virginia. He serves as an advisory board member of the U.S. Conference of Mayors, where he chairs the Children, Health, and Human Services Committee, and as vice president of the Democratic Mayors Association. He previously served under Governor McAuliffe as the first African-American Secretary of the Commonwealth. Mayor Stony has made investing in children and families his top priority. We also have Dr. David Michaels, who is an epidemiologist and professor of environmental and occupational health at the Milken Institute School of Public Health at George Washington University. He previously served as Assistant Secretary of Labor for the Occupational Safety and Health Administration, or OSHA, and as Assistant Secretary of Energy for Environment, Safety, and Health. Worker safety and health is one of his priority areas of focus. Next, we have Reverend Terrence McKinley, who is a national leader in advocacy, public policy, mobilizing, campaigns, racial justice, and civil and human rights. He's currently the Vice President of Movement Building and Strategy at the National Black Child Development Institute, where he works to improve outcomes for children and families through national advocacy and community engagement. Reverend McKinley is also the senior pastor of the historic Campbell AME Church in Washington, D.C. And finally, we have Dr. John Balbus, who is the director of the Office of Climate Change and Health Equity and the Deputy Assistant Secretary for Climate Change and Health Equity. He has served as Department of Health and Human Services principal to the U.S. Global Change Research Program and co-chair of their working group on climate change and human health, senior advisor for public health to the director of the National Institute of Environmental Health Sciences, chief health scientist at the Environmental Defense Fund, and associate professor of environmental and occupational health at the George Washington School of Public Health. So welcome, panelists. Thank you all for being with us today. And I'd like to start first by asking Dr. Balbus, if you can talk a little bit about what we mean when we talk about extreme heat and what populations are most at risk of extreme heat.
Absolutely. First of all, thank you so much, Jill, for having me today and this great panel, and thanks to the Center for American Progress for elevating this topic of extreme heat and health. In some ways, this first question is the hardest one because we don't have a standard or singular definition for extreme heat. Sometimes we look at temperatures over 90 degrees. Sometimes we look at a heat index of 95 or 100, 105. Athletes look at wet bulb globe temperature. I think for this audience, it's the most important thing is to individualize it, because what's extreme heat for one person and life-threatening, may not be for somebody else. So extreme heat is this balance, really, for an individual between what's going on in the environment, how hot, how humid, are they in the sun, is there wind? Acclimatization is really important. So a given temperature, if you're coming from a cold climate and all of a sudden it's hot, versus the way we acclimatize over the summer makes a big difference. The same temperature would be extreme at the early part, wouldn't be so extreme later. Physical activity is really important, and this is where kids come in, right? Kids running around on a playground, or really importantly, outdoor workers, people who are very active, people who are hiking in a national park, football players, and in their gear, how much clothing people have on. All of these things that either generate heat inside the body or trap heat inside the body are really important for an individual. And then lastly, the body has to be able to cool. And that can be impaired at the extremes of age, so kids and the elderly, people on certain medications. So it's all those four things coming together. It's that balance between what's the temperature, what's the humidity, how active people are or have to be because of their job, and then do they have medical conditions or other reasons why they can't cool as effectively. And that tips us to who's most vulnerable and who we see succumbing to heat. It's elderly people, isolated, often not able to afford air conditioning in their homes. It's young athletes, for the reasons we said. It's people who have other kinds of medical conditions, especially people who have mental health conditions, who may not be able to respond to warnings as well, and also are on medications that may impair their body's ability to cool. When we look at who is most, who so many of the deaths that have been happening in a place like Maricopa County, Arizona, it's overwhelmingly there are people who are outdoors, who may not be housed, who are using substances that impair their body's ability to cool, and who don't have the capacity to get themselves into a cool environment.
Great, thank you for starting us off with that. And given having heard some of these most vulnerable populations, Reverend McKinley, can you talk a little bit about what unique health and social conditions lead these populations to be more vulnerable?
Sure. Well, my thanks to you, Jill, and thank you to the Center for American Progress. We at the National Black Child Development Institute believe that Black children and families are particularly vulnerable to the impacts of extreme heat due to systemic inequities. And so systemic inequities in housing, systemic inequities in healthcare, the lack of access to green spaces and safe spaces to play, but also that Black children and families, many of them live in urban areas across the country that don't have adequate tree cover, and are especially susceptible to these issues. A good way to describe this is that in these urban areas, many of them live in apartment buildings that don't have proper heating and cooling systems. And without those heating and cooling systems, during summer months when temperatures spike and you would look for rest from the summer heat, those children and families are left to deal with stifling temperatures in their apartments without the adequate green space and parks in neighborhoods that have been exposed to disinvestment. Their parks are not up to par, overgrown grass and trees. And so playgrounds that are not properly, do not have the proper equipment. And so there's no place for them to then go to cool themselves even in those times and to play. And so we truly believe that there is a need to address the systemic impacts of that lead to the challenges that are faced, particularly by Black communities and Black children.
Thank you for that. So given these, vulnerabilities that communities face, Mayor Stony, I wonder, can you talk a little bit about what you see as the most critical actions that federal, state, and local policymakers can take to protect these most vulnerable communities and populations?
Well, thank you, Jill. And first, let me thank the Center for American Progress for convening this discussion on extreme heat. This is an issue that just about every city in the United States is facing at the moment as we see the challenges with our changing climate. And I think it's necessary that local leaders particularly take on this issue head on and not wait for our friends at the state level or the federal level, not wait for ideologues, whether on the Republican side, you name it, to come save the day. I think it's necessary, and the onus is on us as local elected leaders to take on this issue. And my city, as Congresswoman McLendon stated earlier, we have felt the impacts of extreme heat. Now, just check this out. Recently, the Center for American Progress, in conjunction with our local university, Virginia Commonwealth University, saw that recently that extreme heat events result in nearly 7,000 additional emergency department visits. 7,000 extra, and then 2,000 extra heat-related hospital admissions in the Commonwealth alone. Now, a lot of those visits are coming from people who are in our most vulnerable communities. And I think Reverend McKinley touched on this in a very specific way about who these individuals are and what are some of their barriers in terms of having a lack of resources and also living in areas in their cities or in their localities where they have been unfortunately neglected for years and years, for a generation. And what we're doing in Richmond is we're being a lot more proactive and recognizing, guess what? There have been issues in the past. Our predecessors, who are the practitioners before us, are the reason we are here. There's a reason why these formerly red line areas of our city are now considered our heat islands. They lack shade, they lack a canopy, and we have to go about reversing that. Now, reversing that does take investment, but it also takes intentionality as well, because we know that extreme heat also can create severe economic impacts, such as reducing the workforce and reducing the productivity of our workforce. It can have impacts on students who are living in these areas, and also it can damage the ecosystem in which these families are living. And so what my city has done over the course of the roughly last 8 years, we're doing everything we can to ensure that our residents, especially our most vulnerable residents, are protected from this increasing threat of extreme heat. We are tackling this using multiple efforts. But I think sometimes you just have to reduce it to the lowest denominator. And on what a city, a locality can do. And we are taking the simple approach of, recreating that canopy throughout neighborhoods that were long neglected. We're planting more trees. We're installing reflective materials on streets and roads, and we're expanding shaded areas in our parks and our public spaces. Under our time in the mayoralty, we have seen a 73% increase in our Parks and Recreation Department in terms of funding, which we've also acquired more than 140 more parkland and green spaces to add it to our parks system. Those additions are in our Black and brown areas, in our low income areas, and I think that's necessary to ensure that the most vulnerable do not feel the full brunt and impacts of this ongoing crisis.
Thank you very much for that. Now, turning to another vulnerable population, we know that extreme heat is becoming more dangerous for workers every year. And the Department of Labor's Occupational Safety and Health Administration, or OSHA, has released a proposed federal heat standard to protect workers from heat injury and illness in both outdoor and indoor work settings. Dr. Michaels, can you talk about what that standard would mean for American workers, what challenges are ahead, and what the administration can do to expedite the rulemaking process?
Well, thank you, Jill, and thank you, Cap, for leadership on this issue. So first, I thought I'd briefly describe the proposed rule because it's really sort of common sense and potentially life-saving. Most importantly, businesses need to make a plan, what they're going to do when the heat comes, and then implement that plan. The rule isn't in effect yet, but it actually provides great guidance to employers who want to do the right thing now to ensure their workers are protected. So just in summary, the rule would require employers to monitor for hazardous heat exposure in both indoor and outdoor settings, and then to be prepared for heat by training workers and being ready to respond if and when workers start showing signs or symptoms of heat illness. So before they get really sick, interventions made. The rule would trigger certain protections. The initial trigger is what's called a wet bulb globe temperature. We can go into that at 80 degrees Fahrenheit or higher, which doesn't sound high, but actually with enough humidity, it could be really dangerous. And so at that level or higher, the requirements include access to clean drinking water, break areas where you can rest and rehydrate, and rests as appropriate, but OSHA actually doesn't say how often. When you get to 90 degrees, when heat exposure really becomes deadly, that rule calls for mandatory rest breaks of 15 minutes, at least every 2 hours. And currently only a handful of states require employers to protect workers from extreme heat. If this federal rule is implemented, it would cover millions of workers who are currently endangered by heat, workers baking in the hot sun doing construction or agricultural work, or so many outdoor jobs, but also indoor jobs like working in a hot factory or in a warehouse or Amazon fulfillment center, which are rarely air-conditioned, workers making delivery from unair-conditioned vehicles, and so many more. And, it would have a huge effect. Heat kills by itself, but also increases the risk of cardiovascular events like heart attacks. And when it's hot, the risk of work injuries and car crashes spikes. And there's also benefits to employers, as the mayor mentioned. Working in heat reduces productivity. One study found that for garment workers working indoors, every increase of 1 degree Celsius reduced productivity by 4%. So more breaks will help employers too. So you asked about the challenges. Well, the OSHA rulemaking process is slow, it's cumbersome. The agency provides multiple opportunities for input. There's a very long comment period. The proposed rule is out. There are 120 days where people can send in comments, and then there are going to be hearings and the public hearings. And I tell my students that OSHA hearings are like Halley's Comet. They don't occur very often, but when they do, they're well worth watching. Everybody who testifies has the opportunity to ask questions of everyone else who testifies. And so the process results in rules that are effective and also feasible for employers to implement. And that's true of all of the OSHA health rules that have gone through this process. But we know that no matter what is in that rule, its opponents will take OSHA to court to fight the rule. We know agricultural interests are already working on that. They've said that. The Chamber of Commerce had said it's crazy to have a rule like this. We shouldn't have a one rule one rule fits all. Well, heat is something we know about, we could protect people from. And so because OSHA is going to be taken to court, the agency standards writers are very careful and deliberate. And what they need from the public, from the community, from stakeholders, from us, is the evidence that the provisions that are included are useful and they'll be effective. And so comments by parties and experts are really vital to that process. Not comments like, I think the rule's a great idea, I support the rule. It's not a popularity contest, but answers to the specific questions that OSHA raises in the proposal, the success or lack of success of different approaches, are there better models for costs and benefits, things like that are really important. But it's going to take at least a year or two or maybe more before the rule is finalized. And of course, it will never see the light of day if Donald Trump is elected president. So I think what we have to do in the meantime is do everything we can to ensure workers get the protection they need right now to avoid being made sick or even killed by the extreme heat.
Thank you for that. Representative McLendon referred to the Inflation Reduction Act and the historic investments that it offers to help cool neighborhoods and reduce extreme heat risks. Dr. Balbas, can you talk a bit about ways that you see the Inflation Reduction Act helping to mitigate the impact of extreme heat for individuals and communities?
Sure. But before I get to the specifics of the IRA, I just want to circle back and lift up the words that we heard from Mayor Stony and Reverend McKinley. When I was talking about vulnerable populations, I was really talking about individual factors. But when we start thinking about the Inflation Reduction Act, we're getting at the community level. And as they said so eloquently, heat vulnerability for communities of color and for low-income communities across the country is really a question of cumulative stressors and intersectionality. It's the combination of, and Richmond is the best studied city for this, of not just a generation or two, but centuries of discrimination and systematic racism, culminating in the redlining practice of the 20s, 30s, and 40s that have left communities of color, recent immigrant communities, with less tree cover, with more impervious surface, and therefore greater exposure to heat. But we know that low-income communities of color also have higher rates of a lot of different chronic health conditions like diabetes, asthma, and heart disease that make them more vulnerable, or put them on medications that make them more vulnerable to heat. And then we also have factors like the work settings of low-income populations in this country, either outdoor workers or in hot indoor workspaces. As well as issues of the choices that low-income populations in this country often have to make between food and their medication and paying the energy bills, so that people are left energy insecure without, even if they have an air conditioner. Many of the deaths occur in homes where the people just couldn't afford to turn it on. So all of these things come together to make people more vulnerable. And for the first time, in dealing with heat as a country, we're really transitioning from making sure we put out warnings and heat advisories to actually investing in the disinvested, marginalized communities in this country to be able to restore the tree cover, or put it in for the first time, to be able to ameliorate the built environment, not just the tree canopy, but also the buildings themselves with weatherization programs, et cetera. So the Inflation Reduction Act is an unprecedented amount, hundreds of billions of dollars from this administration, to do everything from, as Representative McLendon said, to assure that we are transitioning to clean energy, but there are billions of dollars for community resilience. There have been billions of dollars between the Inflation Reduction Act and the bipartisan infrastructure law for the tree planting programs. There are weatherizations, and these go along with the pre-existing programs too, like FEMA's BRIC grants, like HUD's community development block grants that can provide funding for retrofits, helping people with their housing, and then programs like the low-income home energy assistance program that helps people meet the energy bills. And I think that's an issue that we really have to address too. That bill has a funding algorithm that goes back 40 years that really needs to be updated for heat. So there's many provisions. It's a little overwhelming, even for somebody in the government, let alone somebody trying to apply for these. Our Office of Climate Change and Health Equity has a quick finder for the IRA that helps people find some of these provisions. I'll just stop there.
Great, thank you. So, Mayor Stony, I know this is not new for you. You've been working on this issue for quite some time. Can you talk about how you have maximized the opportunities available through the IRA, the Inflation Reduction Act, and what it has helped you add to your pre-existing efforts?
Well, Jill, let me start by saying, and I think it's necessary to say that the IRA is the most significant climate legislation in U.S. history. And as Dr. Balbus said earlier, these provisions will accelerate the adoption of the clean energy economy. It's going to create more jobs. It's going to reduce pollution, and it's also going to reduce the greenhouse gas emissions by roughly 40% from our 2005 levels. We saw the IRA as an opportunity for the city of Richmond. I've already stated to you about, we have a past, like many cities have a past. And now how do we go about re-engineering a future, reimagining a future that involves, equitable access to, parks and green space, but also what I believe is, what I think is part of the health, welfare, and safety of our residents, and that is just a tree cover, a canopy. And so we are devoted to that. And I think we want to be the real story that comes out of the Inflation Reduction Act on how you can go about transforming a city. So with the IRA, we have secured nearly $10 million in grants funded by the IRA, $6 million of that, which it's going to use to fund a coalition of Black and Brown community-based organizations, nonprofits, for comprehensive urban greening efforts in neighborhoods that have been historically redlined or underserved or unfortunately overburdened by pollution. These funds are essentially a part of our effort that will fuel, I think, an equity-based way to go about planting trees throughout the city, investing in our workforce development training programs, and also focused on a more citywide urban forest master plan. And with the IRA funded program, the city is now conducting a street level inventory of an urban tree canopy assessment and also tree equity assessment as well. All of this work will ensure, I believe, healthy, robust tree canopy for everyone to enjoy, not just for the wealthy areas of my city to enjoy, but I believe that those also who are working poor or working class should have access to such a canopy as well in their homes and in their neighborhoods. And I think it's more important now than ever that we, like I said, tackle this issue of increasing threat of extreme heat head on.
Wonderful, thank you. As we know, there are many federal agencies with levers to address extreme heat. Dr. Balbus, you kind of referred to the fact that it can be overwhelming. In August, the Biden-Harris administration released a national heat strategy for 2024 to 2030 to coordinate agency efforts to protect communities from extreme heat. Can you share your insights on how this strategy coordinates a comprehensive response to build a heat resilient future for the entire country and what more needs to be done?
Absolutely. So first, one thing I'd say about the National Heat Strategy is that it is as much a product of really well-developed collaboration among 30 agencies of the federal government, as much as it is going to be a driver. It's the product of many years of work among a very large number of agencies, and it's my pleasure an honor to co-chair the National Integrated Heat Health Information System and the Extreme Heat Interagency Working Group, along with colleagues from NOAA, CDC, and FEMA. I think what's some of the features of the National Heat Strategy that are really important. Again, we're making this transition from dealing with heat by defining a threshold and telling people, okay, there's a heat wave, make sure you drink a lot of water, rest in the shade, and just sending out messages and using communication especially at the federal level, as our main modality for addressing heat. The heat strategy lays a blueprint for, first of all, an equitable and community-driven and community-sensitive, holistic approach to heat. So it incorporates, first of all, refining the communication in a culturally appropriate manner, but it also addresses all these other solutions that we're talking about, and addressing the historical sources of urban heat islands, and ways to ameliorate heat islands, ways to ameliorate housing. It brings together the solution space and the science space, and I should say, one of the most important things that's happened this summer has been the development of the heat risk tool. You asked, what is extreme heat? And the heat risk tool doesn't have a number. It has 5 levels of risk that are, for the first time, based not just on temperature and humidity, but are based on the combination of temperature, humidity, the acclimatization factor, the time of year, but also the actual health experience of the locality. It's based on 220 different localities, and what temperature does that locality start to see a higher health risk. So this is what the National Heat Strategy does. It supports the critical research questions. It supports engaging communities, and making the extra effort to go that last mile to the people who are hardest to reach, to people who may be unhoused, to people who may have mental illness, to people who are using substances and aren't watching their phones for the heat wave advisories, etc. So the strategy addresses reaching those who are often the ones who end up succumbing in these extreme heat events. I'll stop there.
Great, thank you. So I'd like to ask each of you what your top priorities are for future action, and what you see as some pivotal actions that individuals and communities can take, as well as policy solutions. So feel free to take the question where you would like to. And I'd like to start with Dr. Michaels. I think you're muted.
Sorry. Thank you, Jill. We know how to prevent heat illness and make sure people aren't killed by heat. 3 words: water, rest, and shade. But we need to change the culture, change expectations around work and heat. People need breaks. They should be given time to take breaks. In fact, they should be required to take breaks, because a lot of people may not be feeling the need for it. But if we want to make sure they're not killed, they need to be able to rest in shade and rehydrate. Now, one approach which I think has been people are looking at and could be effective is for local ordinances. Short of having a federal regulation, it's going to take some years. States and cities should pass laws saying workers have to be given these breaks. I know that that's been tried in both Texas and Florida, and state legislatures and Republican governors have pushed through legislation banning localities from requiring worker protections. I mean, it's outrageous. But in those places where there are legislators that care about workers and governors that care about workers, it's time to pass these, because that'll begin to change the culture, and everybody will realize we need to take these breaks. The climate has changed. It's much hotter, and we can't just keep going on as we always have.
Thank you. Reverend McKinley?
Sure. No, thank you for the question. So at NBCDI, we believe that the way to address the impacts of extreme heat particularly on Black children and families, are related to our 8 essential outcomes at NBCDI. And each of our 8 essential outcomes are designed to create communities that are healthy communities, safe environments for Black children and families. Of those 8 essential outcomes, I would say that there would be a number of priorities that we would name as an organization. One, I would say that access to cooling, equitable housing and spaces and places where Children and families have the cooling systems that they need in order for them to protect themselves from extreme heat. Number two, I would say workplace and caregiver provisions and policy, making certain that caregivers are given access and have the ability to access all of the essential roles that help them with their to do their particular work. Many of those caregivers work outside. I would also say expanding access to healthcare. And so, as we've heard named in this panel discussion, that the impacts of extreme heat heighten, exacerbate existing health issues like asthma and other related issues. We also know that chronic heat stress impacts Black children in profound ways. It impacts their ability to perform in schools. It also impacts their long-term well-being, creating other types of health challenges. And so we need to, in our communities, we need to make certain that we're expanding that access to healthcare. And then the last thing that I would just name, as a national organization with more than 25 affiliates across the United States, when we talk to our community leaders, we believe in a bottom-up, bottom-sideways approach to the work that we do. We also need to make certain that we're investing in intersectional, community-driven solutions. I'm so glad to hear some of the recommendations of the ways that government and civil society and the nonprofit sector can work together. Truly, we believe that that is so important. And I would just encourage this audience, one way that you can be a part of the solution is to join the BCDI. If you're in one of the areas where we have a village or an affiliate, I would encourage you to join a BCDI village or to be or to join our national office, as we're working to impact not only the conditions that we face, but also the systems that allow these conditions to thrive.
Thank you, Reverend McKinley. Mayor Stony, what are your top priorities for future action?
Well, Jill, I think it's very important to have a plan. In 2017, we were intentional about this, and we launched what we call RVA Green 2050, which is our effort to reduce greenhouse gas emissions by 45% by 2030. That's our plan, and our plan involves a number of community stakeholders, the people. It's a people-driven approach, and I would be remiss if I didn't thank what we call our green team of just different stakeholders from across our city who've been a part of identifying, whether it's city-owned land that can be converted to green spaces, or for initiatives that have increased our walkability and accessibility to parks and recreational spaces. We've increased walkability by 80% for our city residents, and it's because of the work coming out of our RVA Green 2050 and the work of our green team. Policy solutions are critical, that's obvious, but individual and community actions also, I think, play a pivotal role in addressing extreme heat and the challenges of our climate. And I think one of the most effective ways that we can go about cooling our streets and cooling our neighborhoods is simply, once again, by planting trees and rebuilding that tree canopy in our communities. We are seeing community groups organize tree planting drives and advocate for more green space. And not only do they provide shade, as I've stated before, but they also reduce the amount of the urban heat island effect that is occurring in these long neglected neighborhoods that were harmed by redlining. And beyond, I think, tree plantings, we must live a very less carbon intensive lifestyle these days with this new climate we're dealing with. And a part of that, I think, is simply, to take a page out of Governor Walz's book, is to be more neighborly. I think that's one of the most powerful and accessible ways we can strengthen our community. Go about checking on our most vulnerable during some of these extreme heat events. That's what we preach here in Richmond. Whether or not you are a senior, whether you're a person with a disability, neighbors who have young children, or neighbors who are struggling with access to resources, you checking on them, you assisting them will help create a more resilient and connected community. And I think the strength of any community begins and ends with its people. And if the people come together collectively and say, you know what, this is a priority not of just their government and of my administration, but this is a priority for our city, I can guarantee that we can get through this crisis like we've gone through crises before.
Thank you, Mayor Stony. Dr. Balbus.
First, I just lift up what everybody else has said. I have three things that I'll raise. The first is, we are, I think, crossing some thresholds in terms of the ability of states and locals to be able to address heat. The phenomenon that we're seeing in the Southwest, it hasn't exceeded the ability of the state of Arizona, but the Southwest used to have relatively low heat-related mortality compared to the rest of the country. They were acclimated. There was a lot of air conditioning. When you look at the numbers, heat-related mortality in the southern tier of states, even though it's much, much hotter, isn't necessarily higher than it was in the northern tier of states. But we're seeing such extreme heat, as Representative McLendon stated, heat where people are getting third-degree burns from the sidewalks and the playgrounds. We're seeing events like the unprecedented heat dome of 2021 that killed so many people in the Northwest. And there have been articles written, recently about cascading events, about events that might really take down the power grid for a prolonged period of time, like a hurricane in the Gulf Coast or Texas, followed by a heat wave. That we really are reaching a point where we need that coordinated federal response when the state and the locality are unable to deal with the scale of a climate change fueled heat emergency. So that's one policy issue. There's a lot of discussion about this right now about how the Stafford Act works, how the existing emergency preparedness is adequate or not adequate to deal with heat. So that's just a policy issue off flag. The second is, I think, I'm very supportive of a very holistic approach to community resilience, and we have been working to support the concept of resilience hubs. The Urban Sustainability Directors Network pioneered these hubs in a lot of cities. There are many cities developing. There are many cities getting IRA funding for them now. These are community-driven, community-managed, community-designed facilities that have a 365-day-a-year function to provide services, but then can double as cooling shelters, as disaster shelters if there's other kinds of events. And we know that heat is not the only manifestation of climate change that's affecting people's health around the country. There's inland flooding, there's hurricanes, there are other kinds of extreme weather events. So ensuring that communities have a place to go that they feel is safe, that they trust, that can provide electricity for people who require electricity, provide cooling, is the second area that we're really trying to promote. And the third is we feel that the health sector has a real role to play. Unfortunately, the Department of Health and Human Services has received zero funding from Congress for climate change work, climate change resilience work outside of the ongoing funding to the CDC's Climate and Health Program and some funding to the National Institutes of Health. There was no IRA funding for the department or for our office. But I think that institutions like community health centers that are trusted, that are embedded in many low-income communities that provide a lot of the healthcare to some of our most vulnerable individuals, have a real role to play in a lot of places around the country, like Austin, Texas, for example. The community health centers are being fortified and made into resilience hubs because they are trusted and they are becoming a place of shelter. And so as we think about that concept of resilience hubs providing services 365 days a year, oftentimes people don't think about them providing the health services. But we're working to, with community health centers, with tribal organizations to get that nexus of, providing renewable energy and microgrids to make them more resilient and capable of continuing to function even in the event of a power failure, and then layering in and weaving in funding to help make them have that additional role in communities as well.
That's great. Thanks so much for that. We're going to turn to some questions from the audience. And actually, you just answered one of them, I think, which was about community resilience and cooling centers. So thank you for answering the question before I asked it. There's a question about, other ways that we can help folks cool down their homes. Mayor Stony, you talked about the importance of checking on your neighbors. That's particularly important. Well, for many vulnerable populations, I was thinking older adults being one of them. But are there any thoughts about other ways that we can assist folks keep with cooling their homes besides lie heap? So what other kind of policy solutions might you like to see that can help people keep their homes cool? Any examples of local ordinances that have maximum temperatures for apartment buildings or other kinds of ideas for protecting renters?
One thing that we have worked on, Jill, in Richmond is in partnership with some of our nonprofit organizations here in town that help outfit some of these older homes. Not only do we find the areas where we see heat island effect, the sort of heat island effect happen in these formerly redlined areas, but also we're seeing these are also places that also have older homes that need some updating in terms of also during the winter time, they have a hard time keeping the heat in. And also during the winter time, they have a hard time cooling the house down. And so we have worked in partnership with some of our nonprofits to sort of outfit and help some of these homes who are a lot of times occupied by seniors in terms of just whether it's new windows or fixing the windows, things of that nature that have helped a lot of our senior adult population. That's something we've been working on, and that's sort of us supporting the efforts of some of those nonprofits I spoke of earlier.
Great, thank you. Oh, go ahead.
Well, and thank you so much, Mayor, for that. And if I could jump in addition to what the mayor has mentioned, in a number of these communities, when takes a while to get to the homes, one of the things that we can do is to make certain that we are expanding the number of cooling centers in these communities that provide air conditioning where people can go when their homes are not an option, particularly during the summer months, and can participate and they don't have access to outdoor spaces where they can get some relief or the trees or the tree cover. And so if we could see more cooling centers, more places and spaces that have adequate air conditioning, that is an immediate need that we could see, an immediate solution to the need that can impact these communities.
Jill, can I add something to what Reverend McLendon just said, and not necessarily focused on residents, but I know that Dr. Michael spoke about workforce productivity, the labor productivity that is hampered by extreme heat as well. For example, here in Richmond, maybe 2 weeks ago, when we had that heat wave that came through the East Coast, our systems here, this is a City Hall here is a building that was built back in the early 70s. We had our chillers, which it's like a big block of ice that we place down in the basement that blows on this, and it flows through the channels of City Hall up to the 17 floors. It broke down. And since the system broke down, I had to send employees home at 2 p.m. because we did not have the mechanism to keep them cool inside and produce them on behalf of the city. Now, luckily, we do have mechanisms now where we can actually work from home and work remotely. But right there was a disruption of our day because of our systems were not able to keep up with the extreme heat that happened in the month of September.
Yeah, that's a great example. And people can work from home if they can cool their homes, right?
There you go.
Except if I can just add, this is like COVID, the blue collar workers, the people who work in essential jobs, who make sure the economy functions, make sure our elderly are taken care of, make sure food's on the table. They can't work at home. People who have power, the attorneys, the CEOs, they can work at home, and therefore they think everything's fine. I mean, that was the problem with COVID. We felt if everybody had to go in to work during COVID, we would have had demands for safe workplaces, and much better control of the virus. The same is true with heat.
Great point. And there are so many fantastic questions, but unfortunately, we are drawing to an end of our time. So thank you for answering those questions. And I just want to thank all the panelists for a really engaging and informative conversation. So thank you for being with us and sharing your expertise today. And I'm going to turn it over now to my colleague, Markeisha Johns, who's the Associate Director of Public Health Policy at the Center for American Progress, for some closing remarks. Thanks again.
Thank you, Jill, and thanks everybody for joining us.
Thank you.
Thank you.
Well, that was a fantastic panel. Thank you again to our wonderful speakers for a dynamic conversation. I just want to share a few highlights that really stuck out to me. Dr. Balbus talked about how difficult it is to really understand who is most at risk, given factors like local temperatures, activity levels, individual health, social and economic factors. Reverend McKinley really highlighted the intersection between systemic and historic inequities, neighborhood conditions, and how that really increases risk even more for marginalized groups like Black communities and low-income communities. Mayor Stony, who is a leader at tackling extreme heat, he makes sure resources are intentionally invested into disadvantaged communities and enrichment by making sure more trees are planted, expanding shading in parks and things like that. And Dr. Michaels did a great job really highlighting that new OSHA rule and how it will protect outdoor and indoor workers, save lives and increase productivity, but also highlighting the role of state and localities in protecting workers as well. This really drives home for me how wide-reaching and complex this issue really is. And as Mayor Stony said, it's touching all people in all communities all over the country. And I loved when he highlighted that the strength of our communities is actually in the people. So this means that it's critical that we have an all-hands-on-deck approach. Our institutions, community leaders, our policymakers, and even us individually need to be able to take full advantage of the opportunities in the IRA and find the best solutions that build on that to make sure folks are fully protected. So I want to again acknowledge Representative McLendon, Reverend McKinley, Mayor Stony, Dr. Michaels, and Dr. Balbus for sharing their insights with us today on this urgent issue. I would also like to acknowledge my colleague, Jill, for doing a great job moderating. As mentioned at the beginning of the event, we hope that you'll continue to follow our work on extreme heat. There are a few more products we'll be releasing that will highlight other extreme heat solutions and populations that are most affected, including ways to protect pregnant people and solutions to improve inequitable access to home air conditioning, which is a topic that came up quite a bit today. So make sure you are checking our Extreme Heat series page for updates. That link has been shared in the chat. Otherwise, we hope you enjoyed the conversation today. Thank you for joining us and enjoy the rest of your afternoon. Thank you.